One of the most common questions we get asked by our patients is, when should I see a family doctor for my child when they're sick? And when do I need the expertise of a pediatrician? This is something that's a completely understandable question, and there is no obvious answer, even sometimes for medical professionals. Pediatricians are experts in children and childhood diseases, and it's a very common misconception that kids are just small adults. They actually have completely different illnesses a lot of the time, and the treatments for them can be completely different from the way we treat adults. So there is a lot of specific expertise that is sometimes required to treat children. So there's a couple guidelines that I can offer to parents when they're trying to understand when they might need a pediatrician. The first broad category of times when I think a pediatrician would be a benefit is if your child has been diagnosed with an ongoing chronic condition that is a complex condition that's difficult for your family doctor to manage. So there's many conditions like this. A couple of examples are things like diabetes in a child, cystic fibrosis, and a whole host of other conditions that require a lot of ongoing expertise management that your family doctor just may not be comfortable with. The other area where I find a pediatrician is really helpful is when your family doctor is actually struggling to diagnose your child. So your child may have a number of different symptoms. They may be potentially not feeding well, they may not be gaining weight, they may have behavioral problems like ADHD that your family doctor can't figure out how to diagnose this and isn't sure how to treat. So in all of these use cases, you've seen your family doctor a number of times, you just don't have the answers. This is when the expertise of a pediatrician may be very helpful to get to the answer and to the management that you need. Now on the other side of the equation, when is it great to see your family doctor? So the day-to-day conditions that your child may have. So things like if they have an ear infection, a throat infection, a cold or a flu, or just for their regular vaccines, all of these things your family doctor typically is great for. You don't need the expertise of a pediatrician for that. But in all these other cases where you don't have the answers you need or you have a very complex condition, a pediatrician may be right for you.